urgent. So and another key stakeholders are European Patients Forum, of course, promoting patient safety, and EKPF is member of APF. We have signed a memorandum of understanding with several institutions as ESOT, the European Society of Organ Transplantation, or ERA, the doctors and nephrologists, and the EDTNA, the nurses across Europe. And I think it is the way to work together. We are on the same team: industry, professionals, patients. I think we need to. Well, we have the same common goal: fight against the kidney disease. And I think together we are strong and we have more power and to reach our goals. And okay. Yeah, I've been honored with invited to be a speaker during the last Congress of the European Society of Organ Transplantation in Milan, in Italy. The presentation was about the responsibility of accepting an organ. As you know, when you have the call to go to the hospital to the surgery, you need to accept the responsibility to the adherence to the treatment and the responsibility to take care of ourselves with nutrition, with education. You know what I mean? To create the willingness to be as much healthy as you can. And yeah, I think it was the very first Congress in presence, face-to-face meeting after the pandemic, and step by step we are coming back to the new normality, trying to combining virtual and face-to-face meetings. I think is the future, and yeah, I think it's a great opportunity that in the professionals and the societies, sciences societies, we have the patients could be have presence in these events as an equal, that to spread our knowledge and our thoughts, to reach the professionals out of the hospital environment, out of the healthcare system, in this kind of opportunities. In regarding the decade of the kidney, we are working together globally with AAKP, because we need to address globally the chronic kidney disease. As you know, 850 million of people are suffering kidney health conditions all over the world. We have a huge problem with the treatments and the time consumptions and a lot of issues regarding the kidney disease, and we are trying to work together with them and because, as you know, AAKP is a very huge and large history kidney patients association, and they have a very well connections in US, and we have learned a lot how to reach the policymakers and the decision makers and try to address and tend to put in the agenda as a priority the kidney health all over the world. And of course, we are always we've been always member of a European Patients Forum. Actually, we have one member of our board of directors in Ulcer, in the board of directors of APF through the Spanish platform of patients. And yeah, we are proud that work together with them, addressing all in general all the patients' needs, not only in kidney, and the patient safety, patient mobility, and I think it's a great opportunity to exchange our goals and try to work together. And regarding publications, I think this year is a great opportunity to be an author. We have published until today three papers as an authors. I will show you each one, and 3 reports regarding anemia or the blood transfusions or AMR, the antimicrobial resistance. It's a silent killer that is coming for the next years. We have published in the clinical kidney journal, Fighting the Unbearable Likeness of Neglecting Kidney Health, again, the decade of the kidney. The authors, as you can see, is the board of directors of ECA, the European Kidney Health Alliance, and we are trying to address that we forgot always the kidney. No, we usually talk about cardiovascular disease or sugar or diabetes or something like that, but we usually forget the kidney until it's too late. And yeah, I think it's a great opportunity to work together with all the stakeholders, nurses, doctors, foundations, and patients together. Flagging that we need to put in the agenda of the policymakers that the kidney disease should be a priority. Another paper that we have published recently in the kidney medicine is expanding the utilization of home dialysis and action for the first international home dialysis roundtable. I'm a member of this home dialysis roundtable, and as you have seen during the pandemic, home therapies are the safest because the people who was undergoing the hemodialysis at centers, they cannot isolate themselves and at home. So we have seen a lot of infections and deaths, at 20% of deaths, 30% of hospitalizations. So we are trying to promote home therapies. We strongly believe that chronicity should be managed at home whenever it's possible. And I think it's a great opportunity after the pandemic, a lesson that we have learned, that the people could manage at home whenever it's possible. And another paper that we have published during the last months in a collaboration with all this is building a bridge between patients and transplant healthcare professionals, is with the ESHOT, the European Society of Organ Transplantation. And of course, is building a bridge is the only way to address our disease with the professionals, and to learn each other how we can improve the quality of care and the quality of life of people with kidney disease. And we have published 3 reports together. One is the Beyond CKD, unveiling the hidden truth of anemia. As you know, anemia is related, associated symptom of chronic kidney disease, but it usually is considered like a side symptom of chronic kidney disease. But it's very confused with fatigue or tiredness. So we are trying to raise awareness about it. It is not normal to have anemia and should be addressed in the early beginning of the CKD, to try to follow up with your daily life activities, with ability to work, ability to travel, or life participation. Because if you are suffering anemia, you are not able to do almost nothing, no? And you are depressed. So this is the findings about what is the anemia regarding the report. And we've been working together with the professionals, trying to address and to raise awareness between the nephrologists and the healthcare community that the anemia is an important issue. Another thing we have learned during the pandemic is the blood in use. As you know, kidney patients maybe could need blood transfusions, because EPO takes time to have effect, 2 or 3 weeks, and sometimes during the surgery or during the treatment, we need a blood transfusion. And when during the pandemic, the blood supplies and all the storage about blood, we need to rethink this blood use and update and upgrade, and action is needed at the UL level. And we've been involved in this report, and I think it's a great opportunity to share with all over the world that we need to rethink, especially during the pandemic, the use of blood transfusions. And another thing that we have in mind and is our priorities is the antimicrobial resistance, the AMR, and how drug resistance infections are undermining modern medicine. Because as you know, people are using and abusing of the anti-infectives, and we need to raise awareness about that, this impact in the drug resistance for the future. Yeah, the expectations are very bad because a lot of deaths will come because we are not using properly the anti-infectives, and I think we need to put the focus on that. And we've been involved in several congress events, and this is one of the most important is the European Congress of Clinical Microbiology and Infectious Diseases. And we've been involved because we have created an Anti-Microbial Resistance Patient Alliance. And I think it's an instrument, a tool to share to the kidney community and to the citizens that the importance of the antimicrobial resistance. And another thing that we've been involved is in a workshop of the rare diseases, in glomerular diseases. I think, yeah, we need to address that the glomerular diseases is not rare kidney disease. There is thousands of people that they suffering for glomerular diseases, and we have not innovation and advances during the last years. During the last 20 years, we have more or less the same treatments, the same options. So we are claiming for innovation and research in rare diseases, specifically in glomerular disease. And we are creating a new transplant patient report outcome. As you know, patient report outcomes have been designed by professionals until today to address the quality of life, health related with quality of life, life participation, daily life activities, sexuality, physical appearance. There's a lot of things that we need to incorporate in this PRO. And yeah, we've been working globally in the creation this new tool with the AKP, with from US, but also from another countries in Europe, from even UK, and I think it's a great opportunity that all the patients together being involved in creation this new tool to measure the quality of life. And as you know, Stella Kyriakides is the health commissioner from EU that have been purchasing all the vaccines across Europe during the pandemic. We've been in touch with her because our vice president in AKBF is from Cyprus, and yeah, we have the opportunity to exchange with her all our thoughts and our claims regarding the prioritization of the kidney patients as a high risk group during the pandemic. And yeah, Stella Kyriakides is very keen to work together with us and to offer her help whenever it's possible regarding our matters and our claims. And AKBF have celebrated 3 webinars during this year. The first one was the World Kidney Day activity. What does it mean with living well with kidney disease? The another one was in June, unmet symptoms, anemia and pruritus. As you know, itching is the most reported symptom in chronic kidney disease, especially in hemodialysis. And yeah, and last one was this week. Is about health education in kidney patients. We've been involved several professionals and high-level professionals and patients together discussion about what does it mean living well with kidney disease. And I think the conclusions and findings are crucial for us. That for patients means this dialysis-free time, ability to work, participation in daily life activities, and improvement of mental health. Another webinar was about pruritus and anemia, and I think we need to address these unmet needs, of course. This is the report. And last one, it was about health education. I think we have learned a lot about the professionals and health education. And as I said, we strongly believe that to empower people, we need to educate. And in an ongoing process, not only because sometimes information regarding kidney disease is giving you at once, and you are not able to process everything. So we need an ongoing process of education. We have set several awareness days: World Kidney Day, PKD, Awareness Day, World Kidney Cancer, and with social media campaigns, webinars, testimonials. And I think, yeah, these days are crucial for us to raise awareness about in citizens, not only in the kidney health community, to try to raise awareness about our disease. And we have created several profiles of social media. As you know, nowadays is really important. Usually patients are in Facebook, professionals are in Twitter, and young people are in Instagram. So we are spreading our activities and our campaigns through the social media channels. And we have released our AKPF manifesto last October, 1 year ago. And yeah, of course, promoting the patient voice and the patient engagement, trying to be focused on the patient-centered kidney care, and always with patient safety and promoting the patient autonomy, including the COVID-19. And yeah, we have spread the AKPF manifesto through our social media and our website. And last, we have several collaborators that is facilitating and pushing our activities as gold sponsors, silver sponsors, and bronze sponsors. And we've been in touch with more companies that are interested to work together with us. And I think this is the way to do it, all together fighting against the kidney disease. And we've been involved in several grant applications in the EU for Health call. It was the last Horizon 2020. Last year we've been involved in 4, but unfortunately the approval is very restricted to few projects. We are only involved in the cordial now, in the clinical validation of continuous peritoneal dialysis flow to the regeneration of the dialysis flow, and we will spread the project. And now in 2021, we are in 6 consortiums, very powerful consortiums with artificial intelligence, genetic cells. So a very hard work with the budgets, and you will see all these projects. The deadline was in 21 of September. You can see here all the countries that we've been involved, and kidney patients are involved through AKPF to spread the knowledge and to create focus group and to exchange with the professionals all our exercise. And yeah, hopefully 1 or 2 or 3 of these 6 projects will be approved at the end, and maybe we can obtain public funds, not only private funds or membership funds. We are trying to obtain public funds from the EU to try to create a strong federation across Europe. And this is the consortiums we have been working during the last summer and during the August. And Juan Carlos have done a very huge job, such a great job, trying to address all the papers. You know, the bureaucracy is incredible, and how do you need to fill all the forms, all the budgets. It's a nightmare, believe me. And yeah, but finally we have done. And let me show you very quick another presentation about ICA. And I think it's this one. Yeah. Okay. Yeah, as I have said before, ICA is the European Kidney Health Alliance, is the lobby in Europe, trying to contact MEPs, the European members of the Parliament. And AKPF is a member of the board of directors. As you will see here, ICA aims to defend the case of the patients with kidney disease in the nephrological community at EU level. The full members of ICA are the Dutch Kidney Foundation, the ADTNA, the nurses, ERA is now the name is only ERA. They have removed ADTA, so they are only ERA. There is the doctors, the nephrologists, AKPF, of course, the patients, and ISN, the International Society of Nephrology. They are the full members of board directors. There are hundreds of affiliate members, as you can see here. And yeah, the membership brings together all the stakeholders together to trying to address that the kidney disease is a burden in Europe that close to 75 million of Europeans, as you know, suffer from kidney disease. This is 1 of 10. And you can see, as I've been sharing with you, that we are on the top 10 of causes of death. But the expectations is that in 2040, we will go up until top 5. So you can imagine how is the urgent to address and to raise awareness about chronic kidney disease. The yearly cost of CKD exceeds to the cancer and diabetes together. So the chronic kidney disease cost is over 140 billion with B annually. So we are sharing this presentation with the decision makers, with the policy makers, to try to address that the chronic kidney disease is a very important issue that we need to address and to put as a priority in the agenda. And the main challenge of the kidney disease in Europe, you know very well, you are very familiar with that, is this circle that is not listed among the research priorities of the European Commission. So it's the lack of awareness. There is a lack of funding. The CKD treatments cost a society more than cancer and diabetes, and the kidney replacement therapy as the awareness is much lower than the cancer, but it's a lack of innovation. The current treatment is not life-saving, and there is not any breakthrough innovation in the last 60 years. We have the same needles, the same vascular access, the machines are not portable, there is a lot of supplies, a lot of water. Complacency is not an option. So I think we need to push and to claim that innovation. And there is a lower life expectancy. CKD patients are in stage 5. The life expectancy and the mortality rates are worryingly rising. So yeah, we are really concerned about this circle, that this lack of awareness and funding and innovation and a life expectancy. And as you can see, the impact of COVID-19 in our kidney patients, as you can see here, is 21% of dialysis patients have died for COVID-19, 20% of transplanted because they are immune compromised have been died, and 30% also of hospitalized COVID-19 patients die of acute kidney injury. We have seen a disruption of the healthcare systems in the access on the continuity to care, to the treatment, and yeah, we have been struggling and fighting for the prioritization. As you know, we are now in the 3rd dose all over Europe. Yeah, the kidney patients, dialysis and transplant patients have been vaccinated with 2 doses, and now during the last week and this week we are with the appointments for the 3rd dose. Yeah, we'll see what happens, because we have a null or a very low immune response after the vaccinations, as you know, especially in the transplant recipients. And all these things is related with the mental health disorder. We were in panic to undergo the hemodialysis at centers, in the public transportations, public facilities. We cannot isolate ourselves at home. So yeah, we were in fear to catching COVID-19 with no clear protocols to manage. So you know where I mean, where we've been living a nightmare during the last year and a half. And yeah, this is the Decade of the Kidney program with the AAKP, as you know, and we are celebrating through ICA and other activities like ICA Forum or World Kidney Day, because we need to write awareness together, all our thoughts. And finally, yeah, we have published a call to action to reduce the CKD burden in Europe, augmenting, of course, always in prevention. Prevention and early detection is the key to delay the progress of the CKD. We are always arriving too late in stage 4 and stage 5, as you know, in emergency, and we need to create more efforts and tools and education in the prevention and early detection. We need to make a research in kidney replacement therapy as a priority to create innovation and to create new treatments, new options. And another thing that is included in the call is to collect and share data. We need data. We don't know exactly how many patients are in stage 4. We only know how many patients are in kidney replacement therapy and dialysis or transplant. If this is not acceptable, we have only estimations of how many patients are suffering chronic kidney disease. Then we need data for everything. We usually say that in God we trust, but the rest, please bring data. So we need data for everything, and the point 4 is to promote home therapies. Transplantation is the best kidney replacement therapy ever, but we need to uptake the home therapies. Chronicity should be managed at home whenever it's possible, and uptake the digital tools. Be careful, don't leave anybody behind. And yeah, this is more or less our discussions in ECA, the action plan, the home therapies, of course, always trying to funding the research and renal replacement therapy, and the prioritization always CKD patients for vaccination. And yeah, this is more or less what we have done during the last year. We've been extremely busy, trust me. And yeah, thank you very much for the opportunity to share with you all our activities and our action plan. And yeah, I remain to your disposal if you have any questions, Michael. My pleasure, and looking very much forward to see you